And so, of course, it's always the ABCs, really, and ABCD. And sometimes we like to say ABC, meaning CAT scan at shock trauma, if they're stable enough to go for a CT. But always airway and breathing. No matter what else what's going on, if your patient's not breathing, then you've got a problem. And then followed quickly by circulation, of course. And so, is there a suspicion of spinal cord injury or fracture? Certainly, if it's a high mechanism injury, car crash with prolonged extrication, rollover, unseat belted, death at the scene, all of these raise your antenna for there may be something going on. Of course, the ABCD, the disability, usually follows. Then you can try to suss out, are they moving all of their extremities? Are they lifting them off the ground? Are they not? The pain and neurologic exam, of course, quick C-spine immobilization until you can figure out what's going on, and try to keep the map elevated. This gets a little tricky in someone who's got an outright hemorrhage and say that they've lost a limb, and the tourniquet's been applied and you've stopped the bleeding. Okay, sometimes that's not the case, and there's so-called permissive hypotension, a systolic less than 90, and so it gets a little tricky if you've got someone with a polytrauma in the management of these. But ideally, you'd like to keep the map elevated. Steroids are not commonly used anymore. They used to be a very high dose steroid course for several days, but we no longer use that commonly. Imaging, CT and MRI are always our friends, the donut of truth. And just a quick definition of spinal shock and neurogenic shock. You'll hear these terms. Neurogenic shock is really more of a clinical diagnosis and state of being. It's sudden loss of the sympathetic nervous system signals. So they're vasoplegic, they're very hypotensive, they're bradycardic because the signals aren't going to the brainstem cardiac accelerator center. Their motor exam could be variable. And it's due to disruption of the autonomic pathways, the loss of the sympathetic tone and the vasodilation of blood is just pooling in the periphery. For spinal shock, it's immediate temporary loss of total power sensation reflexes below the injury. And so the bulbar cavernous reflex, et cetera, you can test reflexes to see is it neurogenic shock or spinal shock. And so they'll present with flaccid paralysis, and this tends to be a temporary thing. Peripheral neurons become temporarily unresponsive to brain stimuli and then improve. The neurogenic shock may not, and they may need pressors or other things to actually clamp down on the peripheral vasculature to bring up their blood pressure.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.